Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the nation's leader in regenerative cell therapies. Today I want to answer the question of, am I too old for a bone marrow stem cell therapy? Now, first of all, the question is, how old are you? Now, there are two ways to look at your age. One is chronologically. What year were you born, right? The other way is physiologically. Now, physiologic age is how old you are, on the inside. And that has a lot of factors to it. What kind of disease conditions do you have? What about your family history? Do you smoke? Do you drink? A lot of things go into that. You may be 20 years older than your actual chronologic age, or you may be significantly younger. Once we reach the age of 50, physiologically, the amount of stem cells that you have internally in your bone marrow or your fat tissue drops off a cliff. And there's a lot of data to point this out, and it's very clear that by the age of 50, the amount of stem cells that you have in your own bone marrow has dropped by over 90%. 90%! That's insane. Now, by the age of 70, the amount of stem cells that you have in your bone marrow compared to when you were born is no longer 90% less, it's 98% less. Okay, so it really continues to fall off the cliff, and it's almost gone, to the ground. So if you're over the age of 50, chronologically or physiologically, the answer is yes, you are too old for a bone marrow stem cell therapy, especially when you consider the other options that are out there. Now, here's some more bad news about bone marrow stem cell therapy. Is research shows that not only do the actual numbers of stem cells drop off a cliff, but the activity of the stem cells that you do have is much less. What that means is that you have stem cells that are basically couch potatoes, and they don't want to do the job as well as they used to. We don't exactly know why. The researchers that saw that thought maybe it's because of all the toxins we've ingested over the years. Maybe it has something to do with the medications we take. Maybe it has to do with smoking, drinking, radio waves, diet. Who knows exactly? But the answer is that's what happens, is we get less stem cells that are lazy, and it makes no sense for anyone over the age of 50 to undergo a bone marrow stem cell therapy. Visit us online today at r3stemcell.com. You can also call us at 844-GET-STEM. All of our centers offer both umbilical and amniotic regenerative cell therapy, which is a better option for you after the age of 50 than bone marrow regenerative cell therapy. We have over 35 centers nationwide. If you call us at the 844-GET-STEM number, we'll be happy to get you in at the closest one to you for a free consultation. Thank you.